everybody, it's Terry and Melanie from RVitaville, and today we've got something different that we're going to do instead of the usual RV material. So as we've been traveling around, staying in the different resorts, we found that probably 1 in 10 of the people we meet have had knee or hip surgery. And I myself have had 2, just had one done about 2 months ago. And so I decided to give you some tips on how to recover a little quicker, because 2 years ago when I had the left knee done, it took me 3 months to fully recuperate, and that was done here in Tucson, like I said, 2 years ago. Now October 22nd I had the right knee done, same doctor, same hospital, and it's been about 6 weeks. Actually it was 6 weeks before I was up and about and everything was just fine. Another week or so has passed because of bad weather before I could film this episode. So I'm going to give you 10 tips on how hopefully you can recover more quickly from knee or hip surgery. Now first off, I'm not a doctor, I'm not a nurse, I have no medical experience, so anything that I show you here is something that I might have learned in the training, the classes that I received before getting my knee done, or things that I might have tried. So please check with your doctor, make sure he's okay with any of these exercises, and take very good care and be very patient with yourself. We don't want to re-injure anything. So the first tip I have is these awesome little supplements called Arnica Montana. You can get them at Walgreens or at Whole Foods or Sprouts, a health food store. Looks like a little chapstick bottle, but what it is teeny little tiny white supplements. They're totally natural, and you take 3 times a day, a week prior to surgery and about 2 to 3 weeks after surgery, and they'll help reduce swelling and bruising in your knee or hip. So the other tip that I need to give you with these, because it took me a while to figure out because the print is so tiny I can't read it, is to get the pills out, you take the top off, turn it upside down, turn the bottom piece upside down over the lid, and then pinch the top between your thumb and forefinger over that lid, and then just twist the bottle. And you will hear those little pills drop out. And you can see, if you can get a good look in there, how tiny those are. And you'll want to take 5 of those 3 times a day. Okay. And they worked great. And the less swelling you have, the more mobility you'll have, the easier to exercise and to heal more quickly. Okay. So tip 2, and this is pre-surgery. If you don't take a class before your surgery and you don't have the exercises available that you'll be doing after your surgery, then go ahead and just Google knee surgery exercises, and there'll be a lot of them out there. So a month, 2 weeks prior to surgery, start exercising those legs, especially the one that's getting the surgery. Aerobics, you can do the exercises that you will be doing afterwards, walking, taking steps, walking upstairs, bicycling, anything you can do to strengthen that. Now one thing here is I've never had a hip replacement surgery, so I don't know what to tell you folks about that except whatever your doctor tells you. So make sure you check with them first. But as for the knee surgery, you want to get those legs and those knees just as strong as you can prior to surgery. Okay, so tip 3. The day you have surgery, make sure you have some healing meditations on your phone or an MP3 player, and have your partner or whoever's helping you after the surgery bring it to you and let you listen to them while you're napping, sleeping, recuperating from your exercises. Believe me, it may sound strange, but just listening to these meditations in your sleep will definitely help quite a lot. Okay? Tip number 4. Start exercising. They will get you out of bed the next day, if not the same day as your surgery, and get you to try walking. So get up and walk as much as you possibly can. Start thinking, I'm back to normal, I'm going to do my normal things, and try and do those normal things. And try with every step to walk perfectly, even if it's slower getting there. Don't try to rush or hobble or skip, because it might cause hip injuries or sciatica, something like that. So you want to walk as much as possible, bend as much as possible, but again, be careful and take care of yourself as you're doing it. And a very important tip is, especially right after surgery until I'd say 6 weeks to 2-3 months down the road, whatever it takes, do not put a pillow under your knee. you'll really want to do that. But it's not good at all, because what happens is you need both the two most important positions for your leg is going to be completely flat and as bent far up as possible. And if you put a pillow under this knee as you're recuperating, it's going to put a little bend in it, and it's going to make it more difficult to straighten out at a later date. So always keep it as flat as possible, and whenever you are sitting down, laying down, try and pull your foot back in a flexed position, pushing your knee down to try and make that leg as flat as possible whenever you think about it. Just keep doing that, and then maybe put a little bit of weight on there. Okay. And then, after your stitches are removed and you can get back in the water, tip number 6 is to do water aerobics. Get in there and start doing a bunch of the leg exercises, all exercises. Get moving again. Water is just so much more freeing. It helps you move so much more easily. And you can even squat down in the water and do little bounces, and the water will kind of help hold you. So that is a really good tip that I always use and really enjoy. Now, tip 7 is these are tips of my own, exercises that I do, and I would definitely suggest you check with your doctor or do it differently, and I'll show you how it would be safer to do. But I come out in my gravity chair, and I will pull a little table up in front of me and put my leg up on that, like I was showing you, to help straighten it out, and just kind of push on my knee a little bit, keep trying to give it some movement. And then as it's stretching further but not really trying to stretch out anymore, it's like it's stuck, I'll actually put some weight on it. And I've started with this weight, and I've gone up to like a 20-pound weight on here. But I have nothing under here to hold. And one lady told me that she went to her physical therapist, and he came in, she was on the table, he put a hand on each side of her knee and pushed down and tore her ACL. So you don't want to tear anything. You want to be very careful, and you know how much pain you can take. So if you feel better about being on a table or a bed and putting that weight on, then do that instead of this weight. But my hamstrings were very tight, and they just didn't seem to be stretching out, so I would put more weight on to help that. Also, in my water aerobics, when I was done, I would get in the hot tub to help warm up those muscles and stretch them out, and I would put my foot up on the steps and stand up and put weight. Again, I took this with me to the hot tub and put it on my knee and left it there to help stretch that out as well. Then the other one I would do is stretch backwards on the gravity chair and just bring the knee up. And if you can't get it up in the air at first, which it'll be very difficult, use your other foot, put under there, and just pull it up with your other foot. Put your hands under your knee, and then just let the weight of the leg hang there and kind of bounce until it reaches a certain point, until it's too painful, and then stop. You can always come back and do it again and again and again. And if it ever hurts, just use your other foot to help hold it up there or to bring it out. But I like this because I can just lean back, get comfortable, and just let it fall down here, and I've got almost my complete range of motion back now. And it took about 6 weeks for me to get to this point. Okay. And then tip number 8, like I said before, walk. A week ago, I believe, I was up to 7,000 steps, trying to get back to my 10,000 steps. And make sure after your long walks and exercise you put ice on it. That's something I forgot to mention too, is that I don't like the pain pills the doctors give you. I don't like what they do to my body. So I would use ice to ice it a lot of the time. So at least 20 minutes every hour, every 90 minutes after every exercise. When I first started, I would take my pain pills, I would wait an hour for them to kick in, I would do all my exercises, and then I ice. And that's how I got through the first few weeks when it was most painful, and then just started using more ice. So on to our next step, tip number 9. Now tip number 9 is a very important one, but it's going to take a little while to get to because you're going to need some mobility because it's riding a bicycle. Now you don't want to get on your bicycle for the first time when you're trying to work your knee. You want to find a stationary bike, and it's going to be kind of difficult to get on there. You just kind of get on, turn sideways, move your weight over to the side so you can get it to turn around a few times, and once you get it loose enough, then it'll start working its way looser and looser, and you can do 2-3 minutes, work your way up, 15 minutes, half an hour. Once you feel good about it, you can get on your bicycle and just go for it and have a good time. But bicycling is one of those really, really excellent exercises. Now for our final tip, tip number 10, steps. If you can find some nearby steps, 3 or 4 steps that have a handrail, and start using the rail to help pull your body up, and use your recovering knee, that leg, to get up those steps and get the weight on there, getting it used to it, then add more steps, and then try and do it without using the handrail. And the more you bicycle, walk, and do steps, the quicker you'll recover and be back to doing your normal activities. So I hope that these tips have helped in some way, that if you have any surgery coming up in the near future, that you will recover quickly and completely. Thank you for watching. Take care from Terry and Melanie in RVitaville. See you on the road.